Hi, my name is Sienna McCaleb, and today I'm going to be presenting on pelvic inflammatory disease. PID is an inflammation of a woman's upper reproductive tract, with the inflammation spreading from the vagina or cervix upwards. It's predominantly caused by untreated sexually transmitted diseases. According to Healthy People's 2020 PID goal, between 10 to 20% of females with untreated chlamydia infections develop PID, and 20% of those women may become infertile. According to Medline Plus's page on pelvic inflammatory disease, it can cause infertility and ectopic pregnancies, pelvic pain, abscesses, and numerous serious problems. Some risk factors include having had sexually transmitted infections previously, because those pathogens can cause PID, having been previously diagnosed with the disease, having multiple sexual partners, because that increases your chance of getting an STI, douching, because this can allow bacteria to enter your body. Don't douche. No woman should douche. And finally, being between the ages of 14 and 25 for two reasons. According to a study done by Das, Rhonda, and Trump, the first reason is behavioral, since adolescents are more likely to engage in risky behavior or have multiple sexual partners. They also have a shorter duration of monogamous relationships and a higher number of them. The second part is biologic, since adolescent girls have a greater proportion of surface area for the microorganisms to infect. So the short answer for what causes PID is sexually transmitted cervical pathogens, according to a study done by Brunham, Gottlieb, and Pavin. More specifically, though, it includes a variety of pathogens such as bacterial vaginosis, according to the women's healthcare physicians, Mycoplasma genitalium, according to Crum Sinoflone, and the chlamydia trachomatic and Neisseria gonorrhoeae. Even though laparoscopy is considered the gold standard in terms of diagnosing PID, it's invasive and expensive. A doctor has to insert a small instrument through an incision in the abdomen to see a woman's reproductive organs. Transvaginal sonography is another option. It will create images that show thickened, fluid-filled tubes, but typically, diagnosis starts with signs and symptoms in a pelvic exam, where cotton swabs are taken from the vagina and cervix so that tests can be run. A whiff test is used to detect bacterial vaginosis. Blood and urine tests are used to measure the white blood cell count, since elevated numbers could indicate an infection. And ultrasounds are also sometimes used to create images of a woman's reproductive organs. The Mayo Clinic's webpage for pelvic inflammatory disease indicates that a combination of antibiotics are used as treatment. Treatment for a person's partner may be necessary in the event that they have a sexually transmitted infection, and temporary abstinence to prevent reinfection. It is important to note that the treatment can differ depending on the severity of the disease and whether or not the patient has a tubo-ovarian abscess. Hospitalization may be necessary if it is a severe enough case. According to the PID page for Healthy People 2020, we don't actually know the exact prevalence or incidence rate for pelvic inflammatory disease. And this has a lot to do with how many women might not even know they have it. The onset of symptoms are mild or even asymptomatic, but I have included some estimates from places like the CDC. To prevent PID, measures need to be taken to educate adolescents. This comes from comprehensive and in-depth sexual education. Both men and women should strive to get regular testing for sexually transmitted infections. And there needs to be promotion of condom use in places where condoms are safely provided. Healthy People 2020 has pelvic inflammatory disease listed as their fifth objective in their STD category. The goal is 10% reduction in the number of women who have experienced pelvic inflammatory disease from ages 15 to 44. These are the references that I used throughout the PowerPoint. Thanks so much for watching. It's been a pleasure.